Hello everybody, this is Dr. Doug from Posture Points. This is another in our continuing series of working on bringing you good information about posture and your nerve system and how it impacts your overall health. Today is another one of those a little bit longer than normal programs. We usually try to keep them at 5 minutes, but this one's a little bit longer. It's actually a presentation we've done in office for strategies for slowing and preventing dementia, and I wanted to get that information out to you as well. We have this currently on a PowerPoint format. You can also go to our web page at carechiroLafayette.org or .com and click on blog, and you'll see some blog posts that are similar to this or have some of the same information. Long term, we hope to get this on a webinar, but we definitely wanted to get this information out to you. So let's go ahead and get started today. What this presentation isn't is it's not going to be a breakdown of all the scientific information on the types of dementia. It's not a comprehensive treatment program for Alzheimer's or other types of dementia. Signs and symptoms of dementia are mild memory loss, trouble finding words, having difficulty organizing or planning, trouble with managing bills or accounts, lack of initiative or motivation, the absence of depression. That can progress. You can get delusions, disorientation, forgetfulness, inability to create new memories, and all the way to the end stages of Alzheimer's, which is, for most people, they understand there's quite a bit of breakdown both mentally and physically. What this presentation is it's some practical strategies to stimulate the brain's innate capacity to express itself. It's going to be some practical strategies to keep from reducing the brain's capacity to express itself. So we want to look at the things we can do to encourage your brain to function right and the things we can do to keep from reducing its own ability to do that. Dementia is really a spectrum disorder. What that means is there's a very large range of different expressions of that. It starts everywhere from where did I leave my car keys to actually what are keys, and it runs that gamut over time in a life. A lot lives under the bridge of dementia and Alzheimer's and other types of dementia. Things like genetics, head injury, smoking, nutrition, stress, medications, alcohol, stroke, high blood pressure, infections, other disease states can all have roles or have an impact on how somebody presents with dementia or cognitive issues. But we're going to leave that to the researchers. There's some amazing tools that they use nowadays, functional MRI, PET scans, there's a variety of different laboratory tests, written batteries that can all help to determine or decide what type of dementia or memory loss or cognitive function problem you have, and those are valuable. There's definitely a place for trying to categorize those, but the reality is there's not a tremendous amount that is done after you've categorized that. Just to be clear, prevention and treatment is definitely controversial. There are many people, if you go to the Alzheimer's website, it's going to say there are no treatments for it. You can see different researchers that say perhaps there may be, and then you can find a lot of people that say yes, you can definitely slow progression or maybe reverse that. So it's a wide open field with a lot of different opinions. I like this quote, and I think you really have to decide for yourself what you want to do. It says, "Dear optimists, pessimists, and realists, while you guys are busy arguing about the glass of water, I drank it. Sincerely, the opportunist." I believe that there's a lot of good information out there, and at the very least, if you do some of those things that are healthy for your brain, that are going to be less stressful for your body, that what's going to end up happening is, even if it doesn't impact the progression of, say, a dementia or Alzheimer's, you're going to be a healthier individual, and I honestly believe that allows you to have a healthier brain and a healthier nerve system. So let's go ahead and look at that. The information I'm basing this program on is, among other things, from a Medscape Medical News article from 2013. It was reported by Brett Stetka. He's a medical doctor, and it was reporting on a researcher named Gary Small, and it was from the American Psychiatric Association's 2013 annual meeting. It's a really good summary article, and Dr. Small has quite the background in terms of research on what's going on in Alzheimer's, and in this particular presentation he talked about things that you might be able to do to ward off or slow down that process. He indicated that only 33% of Alzheimer's is related to genetic factors. He indicated that 66% is related to non-genetic factors, really lifestyle choices relative to the likelihood of getting Alzheimer's. He broke that down into four big categories: physical conditioning, which is basically exercise, mental stimulation, stress management, and nutrition. Physical conditioning had the strongest evidence for preventing Alzheimer's disease and other dementia. Routine exercisers exhibited better cognitive abilities or ability to think and reason. Routine exercisers have bigger brains when evaluated on MRI and other study. Routine exercisers have reduced biomarkers for Alzheimer's disease in the brain and spinal fluids. Those would be some of those research tools that they use to see, is a disease present, is it progressing. Those are called biomarkers, and as the body produces those, generally the more of them, the more likely the disease is to be accelerating. So routine exercise has shown a reduction in those biomarkers, and generally that's thought to reduce the expression of the disease itself. Other studies have shown that routine aerobic exercise improves things like anxiety, depression, stress, and attention, and those are also risk factors for dementia. Minimum effective dose. They found that older people who walked regularly as little as 15 minutes a day have a lower risk for Alzheimer's disease. There is on some level also a dose-related response, meaning the more you do, the better the benefit. So the bottom line normal is if you can hit 15 minutes a day, you're going to actually be reducing your risk for contracting Alzheimer's disease and other dementias. The next thing they indicated was mental stimulation. So mentally stimulating activities and certain brain training programs are in the long term associated with lower brain amyloid levels. Again, these are those biomarkers for dementia and Alzheimer's disease, and a decreased risk for Alzheimer's disease. Also related to that was graduating from college or engaging in lifelong learning. So the more that you challenge your brain, the longer it stays functional and active, and actually in some cases may reduce down some of those markers that show progression of a disease. What's the minimum effective dose? That's a difficult one. I would say for the most part it's considered ongoing, meaning it's not something that you do once in a while. You want to engage these activities as often as you can. Some of the things Dr. Small indicated were crossword puzzles, reading, writing, learning new technology. There was a very interesting portion he described about especially people of a certain age group that are not familiar with things like smartphones and computers and iPads, that learning those stimulated aspects of the brain. He also used what was called a mental game called Look, Snap, and Connect, where he challenged people to take mental snapshots and create meaningful associations. For instance, if you happen to meet me, my name is Doug Williams, and I'm a chiropractor, in your mind you might make the association that that's Doug, and he will adjust or work on people's spines for yams. And so you meet me 2 weeks later and you'll realize, oh yeah, that's Doug Williams. He's the chiropractor that would adjust people for vegetables. That's not really true. So if you do come to our office, you would have to pay money. But that's the game he talked about called Look, Snap, and Connect. I'm actually pretty excited about that one. I hope to do some more research on that and provide maybe another short posture point moment relative to that and give you some more information. So keep tuned to our YouTube channel for that. The next one he indicated was stress management. Stress is a known contributor to cognitive impairment and decline. Human and animal studies have reported the following changes in the brain with stress. Decreased memory or memory impairment, decreased size in the brain again, which is the same thing really as brain atrophy, decreased mental flexibility and attention, your ability to reason or to act quickly. And then again, there's that increased biomarkers for inflammation related to dementia. So anytime you see that things that are either increasing or decreasing biomarkers, those show the progression of the disease. So for instance, if the stress is increasing, then they see that related to more of those indications that the disease is progressing. If those biomarkers are reduced, like we talked about with exercise, then you may also see or assume that the disease is decreasing. Minimum effective dose for stress management. Well, the good news on that is some of the things like exercising is actually a way to impact stress management. Other things that impact stress management are things like sleep, positive relationships, and this is actually a very big one, especially for just general dementia, that the more social relationships people have, the healthier their brains are and the longer their brains stay engaged in a positive and functional way. Prayer and quiet time, thankfulness, or appreciation, counting your blessings, church relationships or other social relationships can do that. And for some people, if they have a lot of real stress-related issues, oftentimes psychotherapy or counseling can be very, very helpful for these people. The next one, or the last one we're going to cover today, is called weight management, nutrition, and anti-inflammatory diet. That's a mouthful, but it actually has to do, for the most part, with what you eat and how much you weigh. Several studies have shown increased dementia risk with being overweight. And they do this by a twin study, which is kind of unique, is they'll take sets of twins and they'll look at them, and let's say one twin is a lot heavier than the other one, and they measure them for cognitive function, and they basically say, boy, they're the same genetically, but one of them has a lot more issues cognitively or dementia because of their weight. They relate it to the weight. Cognitive function, again, or brain function, is improved in obese patients who underwent bariatric surgery. So what that meant is when people lost a lot of weight pretty fast, if they're very obese, that they actually had improved brain function. Now, we're not advocating that you run out and get bariatric surgery, but the relationship between weight and that is really is definitely there. There's been some really cool studies that a combination of B vitamins were found to slow brain loss in areas of the brain associated with Alzheimer's disease and cognitive decline. So, a certain ratio of B vitamins, which is really pretty available and does not have a lot of serious side effects, has been related to slowing down cognitive decline. And recently there's been some good studies that have shown that increased inflammatory markers in the blood correlated with an increase in the decline of Alzheimer's disease patients. What that meant is if you have an increased inflammation in your body, you generally had a higher risk or more problems with Alzheimer's. On the opposite of that is the lower the inflammation in your body, the more that was associated with patients that were very, very stable. Inflammation can be driven by dietary factors for sure, and again, they also think that B vitamins is probably driving down inflammation, and that's why that's effective. What's the minimum effective dose? Well, let's keep it real. First off, you want to minimize fast food. Those are things that obviously gain weight for people, and it's also very, very inflammatory. You want to minimize prepackaged and prepared foods. What that means is anything you buy that has a shelf life to it usually has trans fatty acids. Those are inflammatory in nature. They tend to also be high calorie. You want to minimize fried food, really for the same reason. It has high value in trans fats, which are the bad fats, usually very high calorie content. Same thing with soda, except for with sugar. It's very low in terms of nutrition and very high in terms of calories involved with it. You want to minimize sugar overall. Sugar does two things. It obviously impacts your weight. It also can drive diabetes, and diabetes is associated with inflammation. So going back to those mentioned studies, inflammation drives dementia and Alzheimer's disease. Reducing that sugar intake can be really helpful. You want to maximize fresh fruit and vegetables. You want to maximize broiled and boiled meat. You want to maximize water intake. And I also placed on here you want to increase protein. Generally what happens is when you eat a lot of starchy foods or wheat-based foods, they tend to spike your blood sugar. When you have more protein, it levels your blood sugar. And that is very helpful in terms of weight management, to be sure. So let's sum this up. The facts, ma'am, just the facts. For those of you probably under the age of 50, you have no idea who this is. For those of you over 50, you know this is Joe Friday from Dragnet. And he was famous for asking people to kind of cut the crap and just get down to the useful information. So let's just do a quick review on that. Remember that Alzheimer's disease or dementia is a spectrum. It runs everywhere from where are my keys to what are our keys, and it's everything in between. Remember also there's a lot of things that live underneath the umbrella of dementia and Alzheimer's disease. Many, many different factors. Some you can control, some you can't. There's a great body of research that's going on right now trying to determine this, especially as we have people in our society that are living so much older. We're seeing way more cognitive decline, but the reality is they can describe it, but not necessarily a lot of active treatments in terms of drugs or medications in terms of stopping it or slowing it down. When you look at natural ways to deal with it, it is controversial. There are people that think it's a really good idea and possible. There's people that say no, it's not, and there's people that live in the middle. We tend to be folks that might as well shoot for the best opportunity, and that's what our goal is. Remember, Dr. Small indicated that only about 33% of Alzheimer's specifically they believe is genetic in nature. The other 66% has to do with lifestyle factors. The first of which was exercise, and that minimum dose of even 15 minutes of walking a day was very, very helpful in diminishing the likelihood of getting Alzheimer's disease, and they've sure had other studies relative to general dementias. Remember also that we talked about mental stimulation was very, very important. Things like crossword puzzles, reading, writing, engaging in new technology also kept the brain active. Reducing stress was very, very powerful. It allowed the brain really to rest. Things like positive relationships, going to church, being thankful, in some cases needing counseling or therapy, those can all be factors that can impact that. Getting good sleep also impacts that, and good social relationships. And then the last thing we talked about was nutrition, primarily that food that is high inflammatory in nature can be very, very damaging to the brain and nerve system. Food that is low inflammatory or healthier types of food can really help reduce down that general inflammation. We have some really good articles on the blog on our webpage on anti-inflammatory foods and inflammation with some really good links on that Emily actually helped me create and did a really great job on. So I'm going to encourage you to go to our site and look for those things that are anti-inflammatory. And you'll see some things on exercise there as well. I want to close with this portion, and I really like this scripture. It's Philippians 4:8. It says, "Finally, brothers, whatever is true, whatever is honorable, whatever is fair, whatever is pure, whatever is acceptable, whatever is commendable, if there's anything of excellence and if there's anything praiseworthy, keep thinking about these things." I chose this and this image to end this program with today because there may be things that you can impact, and research may find out in the next 5 years that massively does that. It changes the whole trajectory of certain dementias or disease states, or they may also find that it doesn't. But I think the things that you can only do are focus on moving forward, pick the best things you know to do that create a healthy and functional lifestyle, and engage those to the best of your ability. So I hope you found this information useful. You can visit us at carechirolafayette.com. If you click through to our blog page, we have lots of great articles on there on inflammation, on foods. We have some articles on exercise and different pain things. We're also going to be doing a series this summer both on the YouTube channel and also in office relative to inflammation, specifically on food and some dietary things that can help with weight loss and diabetes and stuff like that. If you're local, you can sure contact our office. We're happy to talk with you about these things or any other kinds of conditions that you have. And then also, if you have a specific question, feel free to email me, Dr. Doug Williams, at carechirolafayette@gmail.com. All right, well, I hope you enjoyed it, and have a great afternoon.